Hello everyone, welcome back to my channel, and the topic of discussion today is Guillain-Barre syndrome. Now, I'm going to take you through the definition, the clinical features, predisposing factors, investigations of choice, and then the treatment and prognosis of Guillain-Barre syndrome. Now, to begin with, how do we define Guillain-Barre syndrome? This is actually an acute onset demyelinating disorder predominantly involving motor system, but it may or may not involve the sensory system. Coming to the clinical features, this is actually an ascending type of polyradiculopathy, and the type of paralysis is flaccid. So this is actually the most common cause of flaccid type paralysis or flaccid palsy, and it always starts from the lower extremities of the patient and then it ascends. It may involve the diaphragm. Now, as we know, diaphragm is also a muscle that takes part in active inspiration. So once diaphragm gets involved, the patient can end up having respiratory failure. Now, the sensory paresthesia that are seen are actually of gloves stocking distribution. So with this you can understand, usually it's the hand and the limb. And patient can also have autonomic neuropathy. So what is that? Patient can present with arrhythmias. They may present with postural hypotension. But in Guillain-Barre syndrome, bladder is not involved. Now coming to the predisposing factors that may predispose a person to have Guillain-Barre syndrome. Certain infections that must be considered, like HIV, Campylobacter, and infection in the jejunum, hepatitis, infective mononucleosis, and sometimes post vaccinations a patient may end up having Guillain-Barre syndrome. Now, what investigations of choice that should be considered? The best initial investigation that we can advise is cerebrospinal fluid examination, where cytoalbuminous dissociation is seen, and patient can have high amount of proteins in CSF, sometimes more than 55 mg%. And most confirmatory test, in order to confirm, we can go for nerve conduction, velocity of motor neurons. We can go for lung function test, and in case this comes abnormal, patient has to go to ICU. This is sort of an emergency where patient may need ventilatory support. Now, when it comes to the treatment, in case the patient ends up having the flaccid paralysis, physiotherapy is compulsory. And sometimes IV immunoglobulins are given and plasmapheresis, but they are never given together, either of them. So this is a conventional treatment plan. If I quote some remedies which can be considered in our homeopathy, just to give a small list, although there are many remedies, but few remedies that should be considered are conium, causticum, Lathyrus sativus, vipera, natrum mur, phosphorus. Again, on the basis of the totality and the complete analysis of the case and what is the presentation of that individual case of Guillain-Barre, we will prescribe. Now, I would also like to give some detail of prognosis of such cases. It is seen that about 60% of the cases recover fully. About 10 to 15% of the cases show incomplete recovery. And about 5% of the cases are seen to have mortality. And the reason for mortality is respiratory failure once the diaphragm gets involved, and often autonomic neuropathies, where I have told you that arrhythmias and postural hypertension, which are not looked after, can end up to be dangerous for patients. So I hope this overview is helpful to you, and please subscribe my channel. I'll be coming up with more such clinical conditions. Thank you so much.